So chapter 21 talks about treatment of worm infestations. Anthelmintics have general considerations. For the livestock business, helmintic infection or gastrointestinal parasitism is a typical source of significant losses due to the animal's poor growth and development. However, in extreme cases, a severe helmintic infection can even result in an animal's death. An intricate body structure distinguishes helminths, which are divided into three groups: trematodes or flukes, which have an indirect life cycle, cestodes or tapeworms, which also have an indirect life cycle, and nematodes or roundworms, which have direct life cycle. Antiparasitics versus antihelminthics. Antiparasitics are medication that lessens the parasite burden by either killing or reducing the proliferation of parasitic organisms. Anthelmintics, on the other hand, are medications or substances that are used to eradicate worms of the gastrointestinal tract. So here are the characteristics of an ideal anthelmintic. Number 1. High efficacy. An effective parasitic effect is required in the drug. So how do we know that an antibiotic has a good efficacy? An antibiotic with good efficacy is one that eliminates 95% of the intestinal nematode burden in ruminants. If it only removes 70%, it means that the efficacy is low. A complete parasite elimination does not necessarily result in a desired consequence because it completely eliminates the source of antigenic stimulation by the organism and may result in a weakened animal's acquired immunity to the parasite. Anthelmintics must have broad spectrum of activity. It means that all animals must be protected from a wide variety of helminths. It is effective against mature and immature worms as well as their larval stages. Antinematodal has been shown to be effective against hypotactic and migratory larvae. Fasciicide should be effective against immature flukes. Anticestodal should be capable of both removing scoliosis and strobili. An ideal broad-spectrum anthelmintic should be active against all of the three types listed above. For instance, albendazole, closantel, and netopamine. Number 3. Modern anthelmintics are projected to have therapeutic index of at least 6 folds. Number 4. Short residence time. Anthelmintics must have short residence time. The medicine or drug should not have a proclivity for tissue accumulation and milk secretion. Withdrawal symptoms should be mild, and these drugs are safer. Prolonged persistence, on the other hand, may be advantageous in non-food animals by offering an extended period of protection against reinfection. Number 5. An anthelmintic is easy to administer. A single dose should be enough to get the job done. Number 6. Anthelmintics should be economical. The material is readily available, inexpensive, and stable when stored under typical settings. There are classifications of anthelmintics depending on the type of helminths they are active against. When we say antinematodal drugs, it refers to drugs that work well against nematodes or roundworms. Anticestodal drugs. These are drugs that work against the cestodes or tapeworms. And antitrematodal drugs are drugs that work against the trematodes or flukes. General mode of mechanism of action of anthelmintics. Anthelmintics can be divided into two major categories based on their mode of action. It's either drugs affecting the energy production of the parasites or drugs affecting the neuromuscular system of the parasites, thereby causing parasite. Drugs affecting the energy production of the parasites. Energy-producing reactions are inhibited, and the usual metabolic process is disrupted. As a result, the following categories of anthelmintics can be identified. First is the inhibition of fumarate reductase in mitochondria. The conversion of fumarate to succinate by fumarate reductase in mitochondria is essential for the generation of ATP. which is also required in muscle contraction, generation of ATP in some anaerobic helminths, especially Ascaris. This process aids in the reoxidation of NADP to produce ATP. The drug inhibited the production of ATP by fumarate reductase, which prevented the parasite from dying from muscular paralysis.
There are also other mechanisms affecting cell permeability and tegument vacuolation. For example is praziquantel, which increases trematode tegument calcium permeability, resulting in spastic muscular contraction. Diamphenetide is an example. Disruption of tegument is another mechanism. Bunamidine, espirantel, and praziquantel are examples of tegument disruption drugs. There is also a mechanism in which inhibit glucose metabolism of fasciola. Diamphenetide, chlorsulon inhibit fasciola's glucose metabolism. Another one is inhibition of parasite reproduction. Parasitic egg generation is inhibited through a low-level feeding of these medications to animals, which reduces pasture contamination by helminth egg, an essential management measure in cattle and sheep management. For example, phenothiazine and benzimidazole. DEC interferes with filarial parasite arachidonic acid metabolism. It opsonizes the parasite for host immune system destruction. Trichostroglius, Ostertagia, Nematodirus, and Oseophagastumum are all common Haemonchus species. Members of the same group frequently exhibit cross-resistance. The following factors predispose parasites to develop anthelmintic drug resistance. Number 1, use of the drug below the therapeutic or recommended dose. Number 2, if it's for a long time, a specific group has been used. Excessive or unjustified use. Extensive anthelmintic use of a protracted period of withdrawal and poor management methods. Approach to overcome resistance include developing management practices to prevent parasite exposure and the usage of anthelmintics as little as possible. Taking suitable control measures against the parasitic phase in the host and the free-living, non-parasitic stages in the environment at the appropriate time. Anthelmintics should be used on a rotating basis. Follow the dose plan and avoid indiscriminate use. A parasitic stage appropriate narrow spectrum compound should be used.